170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
WeFM presents Health Matters, a look at health news and tips which will benefit you. Health Matters, weekdays at 2:05 p.m.
Yes, it's now time for our program, Your Health Matters. Dr. Jerol Thompson, ready and ready to go. Okay, yes. Good evening, good evening. This is your humble servant, Dr. Jerol Thompson, with Your Health Matters. And remember, 457-9997, you could give us a tinkle, give us a call, whether it's a straight call here in St. Vincent or whether it's a WhatsApp call. We certainly would love to hear from you. You know, sometimes we get into topics in which people just sit back and relax and listen to the program, but you're able to call on any subject. Don't feel you're interrupting it. Some people don't like you interrupting the subject, but we love you to do that. So give us a call, give us a tinkle. And if you have any burning question or you text and so on, over the years, I know that persons have been texting or emailing and so forth and asking certain questions. We haven't gotten around to those questions. And I've been saying we need to intensify that. So I think if as of next week, we'll be getting the email out so you could give us those particular questions that you want really answered, those burning health things that are bothering you. But today, I have to talk on a much more complex issue, and that is in relation to AIDS. Now, did you know Monday was World AIDS Day? And you know, most of us, we try to push the subject of AIDS to the back of our mind. We really truly don't want to hear about it. We don't want to know about it. There are things that frighten us. In fact, we even have some scorn and some, we screw up our face when those subjects come up. And some people may even change the channel. And so, but I want you to listen to this, that the World AIDS Day was designated on December the 1st every year since 1988. I remember this well, because as a doctor practicing in the United States, I celebrated this day every year since I was an infectious disease specialist. And it is an international day dedicated to raising awareness on the AIDS pandemic. I didn't say AIDS epidemic, AIDS pandemic has been a pandemic for a long, long time, caused by the spread of HIV viral infection, and also mourning the loss of those who have died and perished as a result of the disease. It was first marked, as I said, in 1988, but the World Health Organization has since become a platform for governments, communities, and individuals to unite in the fight against AIDS. The theme this year is overcoming disruption and transforming the AIDS response. It's very overcoming disruption means that in the whole approach to AIDS, there's been some major disruptions that have taken place. And so how can we overcome those disruptions? And, the the real facts are that, we have seen our global community stand up over this time. And I always hate when we celebrate one day, and really, it's a whole year we should be talking about this. And I hate bringing up AIDS only at around the time of AIDS or World AIDS Day. But it nevertheless stands as a moment of both possibilities and peril. Decades of progress have taken place and means that the world has now gotten tools and the experience to end AIDS as a public health threat. Yes, we have that possibility. But there's the peril that there's going to be some disruption in that whole process, and we won't achieve it anytime soon. Now, new development in HIV treatment, we now have some long-acting injectable medications, right? And let me tell you, we have some medications. I'm going to give you the names. Some new medications. And you tell me what are these funny names? Lenacapavir. We sometimes call it Sunlenca. Sunlenca. This is a long-term injectable and approved drug for both the treatment of AIDS and prevention of AIDS. You hear that? I'm talking here prevention of AIDS. You ever heard anything about that before? Have you heard any Thompson prevention? Prevention of AIDS is now called PrEP. P-R-E-P. Prevention of AIDS. And it requires only 2 doses per year. This lenacapavir, an injection, 2 doses a year, can prevent persons at risk from getting AIDS. It is an important alternative to those who have difficulty with using tablets, pills. And there's all sorts of nice pills that can be used. When taken, sometimes they cause side effects, vomiting and your stomach to be upset and all that kind of thing. There's another medication called CAB. Cabotegravir. Cabotegravir, Cabotegravir. We call it CAB for short. But guess what? This medication is 2 medications in one. It also has in rilpivirine, Rilpivirine. So why Dr. Thompson is giving these stupid spelling things? Well, I want persons to look it up, And this is a medication that's also injectable, but it's given intramuscular every month. The first one I mentioned to you, right, is given twice a year. And this one is given every month, right? Or every other month it could be given. With, this is really good. It is really the first long-acting injectable AIDS drug for a long time. And let me just say that again. There is a new drug for AIDS that you could give twice a year. And another drug that's 2 drugs in one that you give every month or every other month and is a long-acting type drug too. Now, there's a whole set of other treatments and so. But guess what? Did you know that a few persons have been cured of AIDS through bone marrow transplant? Bone marrow transplants have cured a handful of individuals with AIDS, the virus that causes HIV is called AIDS. But this approach is currently still limited. Like if you develop AIDS and you are developing cancer as a result, because AIDS could cause cancer. You could use this medication, this treatment, a bone marrow transplant to get rid of the AIDS and the cancer. But if you just have infections, then you can't do the bone marrow transplant. It's a bit like this. Now, why do I say all this? Well, medications, both the tablets and these injectables, were being introduced into the third world where AIDS has really taken hold in certain parts of Africa. You know, Marlon, what if I told you in certain parts of Africa, 1 in 5 persons carry the HIV virus? Would you believe that? Would you believe that? 1 in 5, 20%, 22% of the population? Well, you know, several months ago, Donald Trump basically withdrew US aid support of many, many overseas programs, including HIV and AIDS funded program. And guess what? While all the countries of the world are celebrating World AIDS Day, the United States, well, Donald Trump declines to mark World AIDS Day as funding cuts threaten HIV prevention. For the first time since 1988, the United States is the only country that's not officially commemorating World AIDS Day. I don't understand that. That's really strange one. Last year, did you know that 44,000 people died from AIDS in that year? Now, the recent abrupt cuts and suspension of U.S. foreign aid, particularly funding for programs like the President's Emergency Plan for AIDS Relief, what we call PEPFAR, implemented through agencies like USAID, have been widely criticized. The cuts have been widely criticized by almost all health organizations around the world. And the way it has caused service disruptions. That's why the theme of World AIDS is overcoming these disruptions and still achieving what we're looking to do. Now, the unintended consequences of these funding disruptions include treatment interruption. Millions of people living with HIV who rely on US funding and antiretroviral, antivirus therapy have been faced stockouts, what do you call it? They use up the stocks and no more stocks available. In other words, there's no medication available anymore when they used to get the medications, right? And this can lead to a host of problems, including resistance and resurgence of disease. Now, disrupted prevention services. If you are not preventing HIV, education and all that kind of thing, clearly, especially around the youth and so forth, you're going to see a surge in these kind of diseases. The health system, the strains, these programs used to fund special nurses and volunteers and so forth to help out. That's gone. And the whole loss of healthcare workers is being a big, big problem. But the big thing is the fact that when you stop providing treatment for HIV, just like COVID, boy, these strains start to become resistant. The HIV virus has many strains as well. And these evolve, these mutate, and they basically can become more resistant and have become more resistant to some of the tablets we once had available 5-6 years ago. So there's a problem. So we've had 44,000 deaths just last year. And the places that's most hardest hit is Africa, Mozambique, South Africa. You know, and when you start going through some of these statistics and you see 1 in 4, 1 in 6, 1 in 7 people with HIV, it's a problem. Now, I want to just say that the aim of AIDS treatment prevention is that you need to have a certain amount of patients in a country who have AIDS to be diagnosed. That they know it. They know they have HIV. If somebody doesn't know they have HIV, they will look to spread it. You know? And you need 95% of your population who are HIV positive to know they're positive. Marlon, you hear that? 95% must know. 95% of them must be on treatment. They must be receiving treatment. So if somebody knows they're positive, but isn't on treatment, they are at risk because they will get sick quick. They will get sick quick, and they may look to pass on the treatment. And we also know that that 95% of these patients who take treatment, guess what? The virus gets suppressed so low, that when we do blood tests, we sometimes can't even detect it. What that means is that the virus isn't making people sick. It isn't driving them to their death as once occurred before. The average lifespan for somebody who's not on treatment is 3 years. AIDS will kill you in 3 years if you are not on treatment. But if you are on treatment, guess what? You could live longer than people who have diabetes and hypertension, or maybe just as long, you know? So there's a 95 target rule. 95% of people must know, 95% of people must be on treatment, and of that, you make sure the treatment is getting 95% of them down so that they're not, let's say, transmissible. They're not so much infectious. Now, they still may be infectious, so don't want to get the impression that you suppress the virus so a person can start having sex with other people. Unprotected sex, no, that's not the goal. That whole education is really important. So education in our schools, reach out, the reaching of students, and expanding even self-testing. You know, there's a building in Montrose at Webb Street. You could go there and get a test. People who really want to know, you know, go there with a girlfriend if you're about to, you know, have any sexual contact, you're on shore and so forth. Go encourage people to get tested. So there's really a lot of things. Now, I want to go back in time. How did AIDS really start? I'm not going to spend much time on this, but I want us to go through. Did you know that one of the earliest documented HIV-1 infection was discovered in a blood sample as way back as 1959, when a man in the Congo, the Belgian Congo, the samples of his blood was kept because he had died of such unusual circumstances. And the initial testing said it was HIV positive. I just remember all this, to quote it. This since did a number of tests and found out, though, that this anonymous person, right, when they retested it several times, it was negative. And there's several persons who they might even be able to identify as patient zero. Persons who may have come from Congo, persons who may have come from Haiti, even persons who may have come from Canada. And each of these stories are fascinating in terms of what really happened. But in May 1969, right, a 16-year-old African-American named Robert Rayford died at the St. Louis City Hospital from a special type of cancer called Kaposi sarcoma. And in 1987, researchers from other universities detected a virus closely related to HIV in that individual. There's a host of history related to this. And there's been a lot of work and books published on where were the initial cases from. Now, to me, I've mentioned this, but I really am not so interested. A Canadian Airlines steward, a male, was referred to, we referred as case 0. And he was really considered to be patient 0. And it's really fascinating, that story. And I say, they did a whole set of tests in homeless people who live in the dungeons and so on, subways, below the subways in New York and those places. They found a lot of crazy stuff, tests there too. And so on and so forth. But what I want to get at is it really wasn't until 1981, 1982 that we first really started to see AIDS. And we made the mistake of thinking that it was only in people who were homosexual, persons who had blood transfusion, or was hemophiliacs, or persons from Haiti, or people who injected drugs called heroin drug abuse, and shared the needles. I was a young medical student at this time, and later infectious disease specialist. My work was HIV in the elderly. What if I told you I had 60 patients over the age of 60 who came down with AIDS? There were some men in northern New Jersey who were wealthy, and they would come down into Newark to pick up prostitutes, take them various places, have sex, and go back up to suburbia where they were living and give HIV to their wives. And some of these were older men. The presentation of these patients, they were coming down with shortness of breath, and we would initially think it's a heart attack. We would think it's emphysema. We would think it is some lung problems. And then we found out there were some strange infections. This was fascinating. I remember presenting a paper in Chicago on this subject. Very rewarding. And I'm way out of my league now because of the whole advances that have taken place. Did you know? You've heard about HIV-1. Do you know? I was on the team of doctors at Newark. This is University of Medicine and Dentistry in Newark that detected the first case of HIV-2 in the United States. Yes, there's a HIV-1, and there's another major virus called HIV-2. Say similarly, but they're different. And they're all kind of subtypes and serotypes and so. Remember when during COVID we were talking about gamma and delta and all these kind of thing and Omicron and it's confusing us. Well, in the AIDS business, it's even more confusing. And after something like about 40 something years, it's even more and more confusing, the amount of different type of strains and so. And do you know, when somebody is being treated for one strain, but they continue to have unprotected sex, they can pick up a different type of strains. That people sometimes with multiple infections. It's really fascinating, and I really had longed for the day when we, in 1989, right, we were now able to have some new tests, something called PCR, special machines that could detect AIDS virus a lot more accurately. There were many, many times I did a test on a patient and the test came back positive. And I had to tell that patient it was positive, but that we would repeat the test. And when I repeated the test came back negative. But I have known cases where on telling the patient they were positive, they went out and did harm to themselves. They went out and did harm to themselves. Wasn't any of my patients when I told them. And so we knew the protocols of when you tell somebody or when you have to tell them, you still give them hope that you will repeat several tests. I had a patient who was a concert violinist, a black violinist. He'd given me several of his records. I treated him for about 6-7 months. He was a heroin abuser. And he had one of the most beautiful wives. She was just so pretty. I mean, I shouldn't be saying that over the air because people would start thinking all kind of things. Marla, she was so pretty. And every time I tested her, she came up negative. She came up negative. He died. And I remember trying to save his life. We had him on a ventilator, on a machine, and doing everything. And I had to come out and tell her that we couldn't save him. I will tell you, that was the very first time I cried in front of a patient. And I couldn't finish telling her that. And you know, there are many times that you have to pull strength because traveling to Kenya, traveling to Nigeria, traveling to Guatemala, going to other parts of the United States to see patients, going to Indian reservations and seeing patients. But more so, just in my office, treating people that you know, people who had contracted HIV is one of the most disturbing things. People you know, I'm not talking about people you have any relationship, sexual. I'm talking about people who you've gotten to know. They were your patients for several years and they pick up HIV for one reason or the other. Or they were referred to you. But I tell you, there is something we call AIDS denialism. And for many years, a lot of people would focus like what I did earlier on. How did we get this? Who put AIDS on us? And so. And it forced many countries to deny. South Africa, this was the case in certain parts of Africa, the thinking that there's no AIDS pandemic, that the US just want to, or other European countries want to curtail the birth rate of the black man and woman. And especially in Muslim cultures, that was the thinking. But let me say that HIV is here, and it is something that will be around for some time unless there is some form of breakthrough. I've pointed out some major breakthroughs that have taken place, but it's not enough. You know, it's really and truly not enough. And it's going to be important for persons to understand what HIV really does. And you've heard it before. You've heard it before. This virus can be contracted predominantly sexually. Whether or not it is through anal sex, whether it is through vaginal sex, whether it is through oral sex, it can be contracted. It can be contracted by someone who is evil, taking infected blood and injecting you as you walk along the street. You know what used to happen? Or if you are a doctor or nurse in a hospital and you're taking out a needle from a patient and you accidentally get stuck with the needle. These are some horrible fates. But in general, it's going to come through sexual contact. When our defenses are down and the sexual urges rage, and the thinking that unprotected sex feels better than protected sex. It's often the case that in families where someone, a woman or man, may be cheating, has a relationship outside, and it's the countless times you've heard a young individual say, I only had sex once for the first time. That might have caused pregnancy, but also might have caused AIDS. And there's also the predatory aspect. There are people who are AIDS, have AIDS, and they go around the world looking for different mates. So that in a number of countries, the prostitutes or so in various countries, boy, I tell you, you'd be crazy to go there, you know? But some people do. And some of the people who go there have HIV and don't care that they're spreading it to the prostitutes. These are some difficult subjects to talk about. But when the HIV virus infects you, you go through a phase. It takes about several months. You know, just like any viral infection you catch, you could get a little fever. You don't notice it. You don't really notice it's a mild fever. But after several months, your white blood cells, some special white blood cells called T cells, they become infected. Matter of fact, these T cells are like the generals of your blood defenses. They're the generals. And this HIV virus is so smart. It ain't going after the foot soldiers. It ain't going after the captains. It ain't going after the sergeants. It's going after the generals. They're the ones who control the immune system. And they start to kill off these T cells so that we can do tests of your blood. I can take a blood test and do tests on your blood and see how much T cells do you have. You're supposed to have a certain amount. You're supposed to have a few thousand. But guess what? Over a period of time, the virus is getting into the T cells, multiplying, and then causing these T cells to literally rupture, jump out, and it goes and infects hundreds of other T cells. And the virus grows inside those tissues, those T cells. Then they rupture and it jumps out and infects others. So over a period of time, your T cell population just starts to drop. But these general T cells, they control your immune system. They tell your immune system, there's an infection over there. There's an infection in your foot. There's an infection up in your eye. There's an infection in your throat. What happens if you have an infection in your throat and your immune system is saying, go down to your foot with no infection there? Or you have an infection in your foot and it's telling you, go somewhere else. Let's take a little break here, right? We come back and we'll get a little more into detail.
An open celebration, not enslavement to addictions, human traditions, or mediocrity. Are you living abundantly?
Health of our society, the future and health of our homes.
People's Pharmacy for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, remember, anybody wants to ask many questions about any topic, number 457-9997, 457-9997, and use WhatsApp also. Is there anything there? We missed the call? My apologies there. Yeah? Oh, yeah. Oh, that's Dave Roberts. Oh, he's probably going to switch and ask me about elections and so forth. You know what I mean? But that's all right, Dave. You can call me anytime. Sorry, I didn't deliberately skip your call. Right? We just noticed the call there. But you know, with I was telling you that people who develop HIV go through an infection. And let me tell you, it's a virus. Any virus causes the same thing. A fever, maybe some swollen lymph nodes, an inflammation in your throat, a rash, muscle aches, feeling tired. You know, almost all viruses can cause things like this. So when I mention this, just because you have a fever, I don't want anybody to think, boy, I might have AIDS. You know what I mean? A rash, you might have AIDS, or muscle aches. No, not at all. But then there's a latency period. This is when the virus is attacking those T cells, those white blood cells, the generals, the ones that control the immune system, not the ones that fight infections and kill funguses and kill bacteria and kill other germs. I'm calling the ones that are directing and orchestrating the immune system, the generals, you know, and they're killing them off. so that there's less and less of these T cells to control the immune system. So the immune system doesn't know what it's doing. It's being suppressed. It's being suppressed, and this phase could take a long time. It can take from 2 weeks up to 20 years, depending on how well the individual is, if nutrition is good and so. Now, in the late stage of the infection, which we call AIDS, right? It is defined by how low. Okay, is the call here? Yeah. Yeah. Hello, good day.
Oh God. Oh God.
Hello.
Doc.
Yes, good day.
Yes, good night. I want to know what happened because I've been trying for a while. You see, I hope it's not perception or what. Anyhow.
But let me stop you there. When the Marlon said, "Oh, you missed a call," right? Because I leave it up to the technician. I said, "Well, he is going to say that I deliberately missed his call." And so I said that on air. So all the listeners would say Dave Roberts would say Thompson deliberately missed a call because he wants to switch the topic and talk to some politics, right? And so said, so done. You come on and you say, well, you ain't take my call because Anyway, you go ahead. Are you?
Yes, as usual. I allow you to carry on.
No, I allow you to. I allow you to carry on. I allow you to carry on. I allow you to say what you have to say because it's predictable what you will say. You know what I'm saying? It's quite predictable. I mean, other people could come back. Other people come back and say, "Doc, you are damn right, man." That man come back and say the same thing you said he would say. Anyway,
I am not anybody's guinea pig or whatever you want to look at.
You're not anybody's guinea pig. How you mean? Yeah. No, what I'm saying, you are pigeonholed. I mean, you're pigeonholed as a not as a guinea pig. You know what I'm saying? You're pigeonholed as something else, but not a guinea pig by any means. Go ahead.
Oh my God, have mercy upon my sinful soul. Yes. If you recall, are you there?
I'm still here. Yeah, you bet. We haven't hung up on you, We don't hang up on people,
If you will recall, many years ago, or when you came into the politics, I said to you, why don't you stick with your medical profession? Do you remember I said that to you?
I tell you something. Some people have told me that, Doc, I need you to go into the priesthood. I need you to go into the religious, because you sound like a preacher. You sound like somebody who would be a good preacher. And they've been encouraging me to do that. You're saying I should not do that. I should stick with medicine. I should not go into the church and so forth.
I just asked you a simple question. I asked you if you remember Dave Roberts saying to you.
But the point I'm making too is that I'm also into the environment. Imagine people tell me, "Boy, don't go into the environment, don't go to the mangrove and those other things. Stick with medicine." We know you just for one thing. You could only do one thing in your life, and that's the only thing you could do. We will block you from doing anything else. Any aspirations and so forth in life, you can't do it. I mean,
well, I don't encourage that. Yes, but I think you're on to a good topic tonight. Let me get. I think you're on to a good topic tonight, especially when I heard you announcing or saying that there's a new pill or whatever.
The injectable medication, yes.
For AIDS.
Yeah.
Right? I mean, this is so important. For instance, you go to Africa, and Africa is always a popular place for reference. It's a continent of how many countries? 50 something, 54. If my memory serves me well. And what is happening in St. Vincent and the Grenadines? Because, first to begin with, when we hear about all these deadly disease like AIDS is and so on, and then you could make an announcement that 1 or 2 people have been cured by whatever means and so on. It's it makes for interesting reading, or what is our case here in St. Vincent going? I don't have the stats. What I find strange, we always have stats of other countries, but we don't have stats of ourselves, which I find something is wrong there. So, how many people are living with AIDS in St. Vincent and the Grenadines? That must be the most difficult thing to find out in our country, right? Either because of lack of development or something. But it's important that we know how we stand in all of this, because it's a worldwide issue. When AIDS came on the scene, and a lot of people, and I interacted with professionals. I always remember a schoolmate of mine, I hope you're listening, who became a lawyer. And he used to say to me, "Robbie boy, I'm frightened. I said, what are you frightened for? If you're living a good life, why are you frightened?" I used to tell him that. I could see that he's listening, he might be getting a good job. He's a married man and all of that. So, where AIDS is concerned, I'm saying all of that because it is not no private thing. Yes, we have our sex. Some of us have multiple partners, and I want this hearing on those, as I talk about my friend. We have intelligence, but when it comes to sex, we can lose our intelligence immediately, and you should know that too, because sex becomes the better part, or we throw everything out, we throw out everything, or we forget what we're doing, and don't stick to precaution, or be aware in the heat of the moment and so on. But I know what it is. I have been there. But I tell you something too, I have to congratulate myself, because I have had to.
You congratulate yourself. You congratulate yourself.
Yeah, I say that because I had to withstand many temptations. I found myself right on the spur, or right in the, just to do what I had to do, and like a voice spoke to me and said, "Dave, don't go there." Right? So I'm very open. I'm very open on these discussions, and you don't find people like that all the time. So that when I say something, it creates a lot of people have this.
Yes. Dave, let me just answer you. In St. Vincent's well known, and it's something that can be Googled, that there's 670 adults and children living with AIDS. And that this represents a 0.4% prevalence. There are some parts of the world where it is 21%. Now, recently, I would say that compared to the 10 years ago and so forth, we've had some measure of success because of the intensity of the programs they've had. So people living with HIV, as I said, the estimated number has been 650. 670, sorry. But in terms of prevalence among young adults, right, it is higher. It is 0.8, almost 1%. Remember, the general population is 0.4%, 1%. So young adults is the, and females is a big issue. So new cases over the last year, they've had fewer than 100 new HIV infections, but that's still relatively high. And now the big thing I was going to tell you about, I remember telling about 95%. Now in St. Vincent, 95% of your people must know their disease, and 95% must be on treatment and because suppressed. But here in St. Vincent, only 80% of our people are actually on treatment. You know what I mean? And it's fairly expensive and so forth in some regards, but they are provided with free treatments. The thing is that people get lost to follow up. So anyway, Dave, let me just end here. I know a couple of the persons are trying to call, and I want to thank you very much for calling and raising those particular issues.
Before I go, let me ask. We have benefited, I think, from the Clinton, if I could call it, foundation. Can't remember what. But
that is over. All that stuff is over. The US has stopped everything. But Dave, let me take this quick call before we go. I know let's take this call. Yeah. Hello, good evening. How are you?
Yeah, how are you doing, Mr.
Not too bad.
Mm-hmm.
Yes.
And big up everybody. You know?
Yes.
Big up the DJ also.
Thank you.
Bless him. Yeah, I heard you was talking about a person who got HIV, right?
Yeah.
And then if the nurses take the needle from the one who get HIV and like me coming to the clinic, to the hospital.
Yeah.
And they stop me with it. I can't kiss it just that way.
You said that happened to you?
No.
Oh.
Man. I'm a clean soldier.
Yes, okay. No. I understand. You could. I'll tell you something. It was scary at some time walking down streets in New York. They were injecting you with stuff. And most of the time it wasn't infected blood. And then a couple of cases they said it was. You know, luckily today we can give you some of these treatments, these intramuscular treatments that can actually prevent the AIDS from developing and so. You know what I mean? So it's a good thing, yeah.
But I want to say this after another question.
Yeah.
So if a person got HIV, right, and you kiss this, just say your partner.
Yeah.
You didn't know she have whatever, you know, and you are kiss. Can you catch HIV by that?
If you kiss her on the cheeks, no. If you kiss her on the lips,
kiss her on the cheek, I know you can't get it.
I know. I'm going to say, if you kiss her on the lips, probably not. But if you do deep-throated, what do you call pulled tongue kiss it, or you
that's what I'm talking about.
Or guess what? Or you engage in other form of oral sex. You understand? Then the answer is there's a higher possibility that yes, you can catch it that way.
Okay.
You understand? And
then another question again, that if the person like bleeding and then touch you with them bleeding and whatever, can you get HIV like that?
Probably not. But if you have a cut yourself and their bleeding blood gets into your cut, you know, as a matter of fact, this is what happens with sex, you know. When you have sex, the friction that's taking place is causing small blisters on your penis. And if the person is infected, the secretions, the HIV virus is in the vaginal secretions. I can get into the cuts and the scrapes and the bruises on your penis. But you ain't going to detect those bruises, but they're very, very small. And the virus can get in through that means. Okay?
Okay.
Yeah.
And then another question. Well, gonorrhea, I know gonorrhea comes from only one thing, right?
Yeah.
But if you know, in the bed with someone or whatever, and then you go in the bed and lie with them, and then, you know, stuff like that. I know that. But I know HIV can come from a lot of farm, as they say. From an eagle.
I'll tell you something. If people can have multiple infections, you know, a woman can have gonorrhea and she can also have AIDS, so that if you have repeated sex with her and you catch the gonorrhea, it increases your risk of also catching the AIDS virus. You know what I mean? That's what I'm saying to you. Yeah.
Right. That means right. You intake of getting both of them.
Yes.
Okay.
Brother, thank you very much. I'm all right. I think we come to the end of the program.
We got my friend.
Yes, man. All the best.
Maka, and you have a big up.
Okay.
You can check it, man. Your friendly. Releaser.
Okay, all right. Yes, I tell her.
So good, so
yeah.
Releaser, you're good soldier.
Yes,
right?
Yeah, man. Just beat up on me on Monday morning, but that's all right. I handle it. Attacking the licks, attacking the blows. I'll see you. Yeah, man, they just beat me all the time. We talk. I can handle licks, man. I can handle.
Come on, man.
Anyway, all the best.
Blessing and respect, man, and keep on share your knowledge,
Thank you very much, brother.
Yeah, but I stay clean, man.
Yes, stay clean. Stay clean. All the best. When we come to the end of the program, I don't want to go over. Listen, we've been talking about HIV/AIDS. We got to continue this with once a year, just because it's World AIDS Day. We have to talk about these other things a lot more because it's enlightening. It can help you. It can help to prevent certain type of disease. Ladies and gentlemen, it's always a pleasure. Good evening and good night.